Heart failure sounds scary, right? But what many people don't realize is that it often starts subtly. It's not usually a sudden, dramatic event like a heart attack. Instead, your body gives you little hints, clues that something isn't quite right. The problem is, these early signs are so common, so easy to dismiss as just being tired, getting older, or being out of shape. Today, we're going to talk about 10 of these sneaky signs of heart failure that you might be missing. Recognizing them early can make a huge difference, so stick with me. This isn't about causing panic. It's about being proactive with your health. Let's start with the most common one, shortness of breath. You might notice it when you're climbing stairs, carrying groceries, or even just walking. You might brush it off, thinking you're just not as fit as you used to be. But here's the key difference. With early heart failure, you might also feel breathless when you're lying down. Do you find yourself needing to prop your head up with extra pillows just to breathe comfortably at night? That's a classic sign called orthopnea. It happens because when your heart isn't pumping efficiently, fluid can back up into your lungs, making it harder to breathe when you're horizontal. Next up, number 2, persistent coughing or wheezing. This isn't your typical cold or allergy cough. It's often a dry, hacking cough, or you might notice a pink or white, frothy phlegm. This again is due to that fluid buildup in the lungs, something doctors call pulmonary congestion. If you have a cough that just won't go away, especially if it gets worse when you lie down or exert yourself, it's worth paying attention to. It's your body's way of trying to clear the fluid from your lungs. Sign number 3 is something you might notice in your feet, ankles, or legs. Swelling. The medical term for this is edema. When your heart can't pump blood strongly enough, blood flow slows down and backs up in the veins. Gravity then causes this excess fluid to pool in the lower parts of your body. You might find your socks leaving deep marks on your ankles, or your shoes feeling unusually tight. Some people even notice swelling in their abdomen. If you press a finger into the swollen area and it leaves a temporary pit or dent, that's a telltale sign of this kind of fluid retention. Let's move on to number 4, feeling tired all the time. We're not just talking about being sleepy after a long day. This is a profound, persistent fatigue that doesn't get better with rest. It happens because your heart can't pump enough oxygen-rich blood to meet your body's needs. To compensate, your body starts diverting blood away from less vital areas, like your muscles and limbs, and sends it to the brain and heart. This leaves your arms and legs feeling weak and your whole body feeling completely drained of energy. Simple daily tasks can start to feel like a marathon. Number 5 is a bit surprising, a lack of appetite or feeling nauseous. You might feel full even if you've barely eaten anything. This happens for a couple of reasons. First, the digestive system receives less blood, which can interfere with normal digestion. Second, that fluid buildup we mentioned can also happen in your liver and digestive tract, causing a feeling of fullness and discomfort. If your appetite has mysteriously vanished and you're feeling sick to your stomach, it could be your body's way of signaling a deeper issue. Sign number 6 is an increased heart rate. You might feel like your heart is racing, pounding, or fluttering in your chest. These are called palpitations. This is your heart's way of trying to make up for its lost pumping capacity. Since it can't push out as much blood with each beat, it tries to beat faster to keep up with the body's demand for blood and oxygen. It might feel like you just ran a race, even when you're just sitting still. It can be unsettling, and it's definitely a sign to get checked out. Now for number 7, confusion or impaired thinking. This can be one of the more alarming signs for both the person experiencing it and their loved ones. It might manifest as memory loss, disorientation, or feeling foggy. What's the connection to the heart? It all comes back to blood flow. Reduced blood flow to the brain means your brain isn't getting the steady supply of oxygen and nutrients it needs to function properly. Sometimes changing levels of certain substances in the blood, like sodium, can also contribute to this confusion. Number 8 is rapid weight gain. And we're not talking about a few pounds from holiday indulgence. This is a sudden gain of 2 or 3 pounds in a 24-hour period, or more than 5 pounds in a week. This isn't fat, it's fluid. It's another sign of that edema we talked about. The fluid that causes swelling in your legs and ankles is building up throughout your body, and the scale is one of the first places you might see that change. Many doctors advise heart failure patients to weigh themselves every morning for this very reason. Sign number 9 is needing to urinate more often, especially at night. Have you found yourself waking up multiple times a night to go to the bathroom? Here's why that might be happening in heart failure. During the day, when you're upright, gravity keeps a lot of that excess fluid in your legs. But when you lie down at night, your kidneys get a better blood flow, and they start working overtime to process and remove that stored-up fluid from your body. So, if your nightly bathroom trips have suddenly increased, it could be linked to your heart's function. Finally, our 10th early sign is anxiety. Feeling anxious, restless, or having a sense of impending doom can be a symptom. Part of this is psychological. The physical symptoms, like a racing heart and shortness of breath, are naturally scary and can trigger anxiety. But it's also a physiological response. Your body is in a state of distress, and it activates your fight or flight system, flooding you with stress hormones that can make you feel panicked and on edge. Your mind and body are trying to tell you that something is seriously wrong. So there you have it, 10 subtle signs that could point to early heart failure. Shortness of breath, a persistent cough, swelling, fatigue, loss of appetite. A rapid heart rate, confusion, rapid weight gain, frequent urination at night, and anxiety. Seeing one of these signs alone might not be a cause for alarm. But if you're experiencing several of them together, or if any one of them is new or worsening, it's so important to talk to a doctor. Early diagnosis and treatment can slow the progression of heart failure and dramatically improve your quality of life. Don't dismiss what your body is trying to tell you. Listen to it and take action. Your heart will thank you for it. Thanks for watching. Please consider subscribing for more health insights. Stay safe and be well.